Okay, so I'm going to talk about mindfulness. I'm going to do a little bit of history, a little bit of its applications, and a little bit about where we might go in the future. So mindfulness has been practiced in the Buddhist tradition in particular for 2,500 years. And essentially, mindfulness is about paying attention. It's about noticing what's going on. It was interesting, Sean's comment about noticing what our information diet is. It's sometimes, the Buddha said that our minds are like a wound, and they're very, and we don't protect them. And it's interesting what Sean was saying about not noticing the effect of the input on our minds. So, in a way, a key aspect of mindfulness is about noticing what's happening right now. Our minds are so often somewhere else, worrying about the future or sort of thinking about the past. So you might like to just notice what you're thinking about right now. Maybe you're completely here with me, which is fantastic, but there's quite a good chance that you might also have a bit of your mind be wandering off tumble-dryer fashion into some other thoughts that have been listed there. And also you might just sort of notice what that's like, when your mind is doing that. They did. There was a nice little study that was done with using the iPhone, where they asked people how they were feeling right now and whether they were thinking about something other than what they were doing. And what they found is that almost half the time, people's minds were wandering, interestingly, except when they're having sex. So we could have a whole thing on mindfulness and sex, but it seems like we don't need to do that because we're pretty present when we're doing sex, broadly speaking. But yeah, so what this showed was that when our minds go off, we tend to be less happy than when we are present. So yes, mindfulness is a training that can help us to be more present. Mindfulness as a therapeutic modality was first made popular by Jon Kabat-Zinn. So he was American, he worked in Massachusetts, and what he did in the late 1970s was he set up a stress clinic. So what he did is he took people with severe chronic pain, sort of unstable angina, severe backache, all sorts of different sorts of physical pains that the physicians couldn't do anything more for. And he gave them an 8-week course in mindfulness, so mindfulness meditation, mindfulness exercises, and some simple yoga stretches done mindfully. And he found that about 2/3 of people benefited and improved in their pain, including at a follow-up in 4 years later. It then became extended to use in a whole variety of other ways, say in stress. It showed improved empathy and self-esteem, which I'll come back to at the end. Nice little study he did where he gave one group, he had a waiting list, the other group he gave the 8-week mindfulness course, and then they gave them a flu jab. And the people who'd done the mindfulness course had a better antibody response than the people who were in the waiting list control. Now, although that was very popular and became very popular in the States, it didn't really catch on over here until the work of these people, that's Siegel, Williams, and Teasdale. So these were some cognitive therapists who were tasked with finding a way of giving a sort of maintenance form of cognitive therapy that could help people to stay better from recurrent depression. Because we know that what happens with depression is if you've had one episode of depression, there's a 50% chance of a second episode. If you have 2, there's an 80% chance of a subsequent episode. It very quickly becomes a recurrent disorder. Now, if you look at what happens in recurrent depression, what this chart shows is the blue one at the left-hand side. This is 3 different studies. shows that the first episode of depression is likely to be preceded by a life event. So some big thing happens, like a bereavement, you lose your job, something like that. But then with each subsequent episode, it's less likely to be caused by a major life event. So the question is, what was going on in recurrent depression? Now, I apologise, this should of course be a Guernsey cow, but hey, that was what Free Photos had. They didn't seem to. Maybe we should get onto Free Photos and get some Guernsey cows. So what seems to happen in recurrent depression is two things. So one is that so what cognitive therapy originally thought was that people who are prone to depression have negative thoughts. They think, you know, I must be perfect, and if I don't do perfectly, then people won't like me, and so on. But what they found is that when people are well, they didn't have those sort of negative thoughts. However, what they found is that if you do something to just sort of lower the mood, I don't know, you play some Leonard Cohen music or something like that, and you may feel a bit sort of sad, then these negative thoughts start appearing. So there seems to be two phenomena that happen in recurrent depression. So first of all, there's a thing called a discrepancy monitoring. So it's kind of like an antennae that's out there to notice the difference between how you are right now and how either you think you should be or how you think everybody else is. So for example, you go to a party and you look around and everybody else seems to be happy, or you go to a conference like this and everybody else is chat to, you know, lots of people, and you're just sort of standing there like a sort of lonely, poor, sad, introverted person. And you just think, oh, it's terrible, you know, what's wrong with me? How come everybody else can, you know, be really friendly, but, you know, I'm not, and I'm not enjoying it. And the effect of that is to create a lower mood. And then what that does is it triggers more of these sort of negative, unhelpful thoughts. And then the second process, which is called rumination, which is a bit like a dog worrying a bone, is you just like go over and over this sort of stuff, like, oh, why is it? What's wrong with me? Oh, look, I'm feeling really miserable now. Look, everyone else is so happy. Why am I such a misery guts? There must be something wrong with me. I must go back and go to the GP and get some more SSRIs, or, you know, whatever. So there's these two things that go on, discrepancy monitoring and rumination, and this creates a downward spiral that makes it more likely to get depression. So it's a bit like these, what happens is these negative thoughts sort of swell up and they're just fully in your face. It's like you can't, it's just the main focus. So what cognitive therapy seems to do, when it's successful, is what's called decentering, which is where you're able to, in a way, have a bigger spacious awareness, where you're not so strongly identified with the negative thoughts. And the way that's traditionally done in cognitive therapy is through challenging the negative thoughts. So what happened is Teasdale, William Siegel, they got interested in John Kabat-Zinn's mindfulness as a possible way of helping with this decentering. They thought originally they'd put in a bit of mindfulness into a standard CBT course, but they eventually ended up with basically a mindfulness course with a little bit of CBT in. And they did a 3-centered trial that compared, that looked at using mindfulness, and it showed that it reduced the relapse rate by half in people with 2 or more episodes of depression. So again, quite interesting finding, because again, this idea that probably earlier episodes of depression are more likely to be associated with adverse life events, but subsequent episodes are more likely to be associated with how the mind works, this phenomenon of discrepancy monitoring, rumination. So that's just a graph showing the comparison between the mindfulness-based cognitive therapy, MBCT, and treatment as usual. So since that time, there's been a whole explosion in the use of, in studies in mindfulness. So that goes up to 2010. In 2013, there were over 700. Last year, there were about 1,000 studies looking at mindfulness. So a very big explosion in interest in using mindfulness. And there's been a couple of meta-analyses. It's particularly shown to be effective in depression and anxiety, but it's also, there's evidence for its use in the other things listed there, pain, stress, and addictions. And you're getting some early results suggesting it can be useful in this whole range of different disorders that I've got listed there. If you look at what happens to people's brains who do mindfulness, you'll see that mindfulness training is associated with a shift into increased activity in the left prefrontal cortex, which is associated with a happier, more optimistic outlook. You'll see changes in brain waves associated with heightened attention, and also changes associated with, particularly with increased body awareness. So I'm just going to run through the ABC of mindfulness. So this is just kind of a simple way of understanding what we do, what happens in a mindfulness course. So the first thing, the A, is simply becoming more aware. So we simply notice what's going on. We notice what's happening in our body. We notice our breathing sensations. We notice what our thoughts are doing. We notice what our feelings are. A lot of the time we're running about on automatic pilot, where our mind is elsewhere and we're just running on autopilot. When we do that, it means we're more prey to passing moods that may or may not be very helpful and that can take us in directions that aren't very useful. We can just get caught up in rumination, whether that's depressive rumination or anxious catastrophic rumination or any other sort of unhelpful, sort of repetitive thinking. So that's the starting point. It's just like starting to notice what is going on, what's happening. But then in the next thing, which in a way is the sort of crux of mindfulness, is learning to be with what shows up, learning to accept our experiences, particularly when they're difficult. Because our tendency is to want to push them away. One of the reasons why John Kabat-Zinn's work worked with chronic pain is because one of the things is we get physical pain, and then, of course, we don't want it. So we try and mentally push it away, and that leads to a contracting, a tightening, which then exacerbates the pain. So the more we can actually turn towards it, then there's a chance of letting go of some of the extra pain. It's sometimes said that pain is inevitable in life, but suffering is optional. And our suffering is our response to that initial pain. So how we respond to it makes a real difference. So if we can turn towards it and be with it, it can make a real difference. And although we have long meditations that can be really helpful to practice that, it can be done also just quite quickly. So just a little example. When I was working as a junior doctor on call, I had one job where rather than using a bleep, what they did is there was a telephone by my bedside. So imagine it's 3 in the morning. I managed to get to sleep. Compassion ran out about midnight. And then at 3 in the morning, the telephone goes off, and I have to pick up the telephone from the depths of sleep and try and be vaguely human to the poor nurse who's woken me up. Frankly, the last thing I want to do is either wake up or get out of bed. So I'd find myself feeling really quite irritable at that point. So what I used to do is when I heard the phone go off, I'd lift up the phone and just hold it out for a breath or two and go, this is horrible. But in just accepting that was going on, just in that moment, just in a couple of moments, it then meant when I answered the phone, I could be a bit more human to the person who'd called me. So yeah, we can learn to be with our experience. And then if we can do that, we're in a much better position to decide what to do next. We can then make some wise or skillful choices, decide what to do. Okay, so just to give you a bit of a flavour, here's a couple of people who've done the MBCT course that I've taught. Tell you what they say about it. So, Throughout the course, I feel I've progressed significantly. Although I've not had time to do the practice every day. That's one of the things about the mindfulness courses, a lot of home practice, and most people don't do it all. But as this person said, even though I haven't done it every day, I've developed an awareness of my negative thought patterns and reactions to situations. So becoming more aware of what's going on. By using the breathing space, so that's like just a very mini meditation, that's just a way of just stopping and noticing where you are, I've reacted in a different way to difficult situations, rather than trying to control or change, becoming aggressive, upset or angry. I've been able to recognize such situations, take a deep breath, and accept that I can't change or improve the situation. I feel less aggressive than before and have an inner peace. Okay, so that's one person. And someone else said, I have been given an experience of applying a new set of tools that I can reach for both in times of crises and in daily routines. And that's one of the things that people really report a lot who've done the mindfulness courses, is getting a set of tools that they can use in their lives that they can find really, really useful. These tools are simple yet effective and have moved me beyond moments of despair and helplessness in the face of recurring depression. The sitting meditation has opened my eyes to the transitory nature of my mental states in a way that I've not experienced before. If you can notice that things are transitory, it's easier to let go of the unhelpful narratives. Personally, it's been helpful the course has avoided explicit Buddhist terminology and stuck to urban realities, which I quite like. Okay. So, mindfulness has got a lot of scope for use in a whole range of mental health disorders, as I said. But I think mindfulness could also be useful for those of us, well, it can be useful for everyone, actually. Okay, I'm a mindfulness advocate, but it can be particularly useful for people in the caring professions. So what we know certainly with medical students, and I think this applies to most health professionals, is medical students start medical school with high levels of empathy. As they go through their training, their empathy levels go down, which is rather alarming when you think about it, isn't it? But this seems to be what happens. So a colleague of mine, Russell Razak, he did some studies looking at mindfulness and found that there was a strong relationship between how mindful clinicians were and their therapeutic relationship. So in other words, how well they were able to form a therapeutic relationship with their patients. There have been a number of studies I've listed here some with medical students, but also with other health professionals, other health students, showing that mindfulness can improve their empathy levels, they can help them to deal with stress, and also improve their compassion. So that's a study looking at self-compassion and finding that students who are more compassionate to themselves are also more compassionate to their patients and others. So I think in the future, one of the things that's starting appearing is more sort of explicit introduction of compassion into mindfulness. There's some studies that suggest that when mindfulness works, the quality of awareness that you're developing is a compassionate or kind quality. So this is being built on partly through, so there's mindful self-compassion, which is built directly on sort of mindfulness training. There's Paul Gilbert's compassion-focused therapy, which is a therapy that's explicitly about developing compassion. And then I've developed kindness behavior training as a sort of follow-on course for people who've done the mindfulness courses to more explicitly develop kindness. And I think you can see these all having a beneficial effect on each other, so that the more aware you are, the more likely you to develop kindness. The more kindness you have, the more helpful your behaviour is likely to be, which then means you're more likely to be make it easier to develop awareness, and so you have a virtuous cycle going on. So just as a final word, I think you can think of mindfulness as, for those who want to do it, it's certainly not everybody's cup of tea, but for those who want to, it gives a set of tools that can help in a whole range of mental health problems, but not just in treating the actual health problem itself, but also to promote longer-term recovery. And in addition, it can help to promote resilience and in staff. One of the things I've been doing recently has been doing mindfulness training for GPs in London. And very nicely, one of the GPs who did the course said she was just about to stop being a GP. It just got so stressful that she was about to give up being a GP. But after doing the course, she decided to stay in general practice. And I don't know about you, but I'd quite like a mindful GP when I go to see my doctor. Thank you.